Hey everybody, welcome to the East Tennessee Health Forum. It's November 2024, and we're actually wrapping up our first year of the East Tennessee Health Forum. We're really here as a group of healthcare workers, from docs to mid-levels to nurses to health coaches to pharmacists to researchers, anyone with a health-focused job. And our sole desire is to drive community amongst ourselves, learn in community, support one another, and the hope is that the rest of our community is blessed and served by that, and so we can help improve the health of our whole region. So far this year, we talked about the power of group visits. We talked about integrative medicine at the Cleveland Clinic. We talked about the future of psychedelic medicine with psychiatric health. And then we talked about underlying causes of anxiety, depression, and bipolar, which is a fascinating talk. Tonight, we are finishing the year with a traumatic brain injury talk, where we're talking about after someone's had a concussion or a TBI, traumatic brain injury, what are some things we can do to help that patient recover quicker and recover for the long haul? Because we all know a concussion can last for many months and years. And up until the last decade or two, it did not get a lot of publicity. So we have a specialist coming into the area, Dr. Michael Trayford out of Asheville, who treats everyone from Navy SEALs who have had injuries to UFC champions to 7-year-olds to stroke patients. So he treats the whole gambit, and we're looking forward to learning what he has to share tonight. So thanks for joining us, and continue to tune in.
Thank you, Dr. Mabry. This is really a tremendous group. I think I've been to all of them since it started, and it is well worth the 3-hour round trip up and down the mountain. And I just commend Michael for everything he's done with this. It's really well put together. Just the topics, diverse array of people coming here, sharing their experiences, their knowledge, their insights. I just love what you're up to up here. So you need to start a satellite down in Asheville. I'll still come to this one though. So what do I have? 2 hours, I think, right? Yeah. Okay. It's funny, like it's putting this together. Yeah, I do a lot of continuing ed. Excuse me. In addition to clinical practice, I do a lot of teaching for medical laser companies and conferences and things like that. And I find it easier to do a 12-hour CE talk than doing a half an hour crash course on something that I do each and every day, because there's so many layers to it. But what I really hope for today is just that you take something away from this. Everybody, it doesn't matter what you do, is seeing concussion and traumatic brain injury in their practices and their lives every single day. And we'll talk about some statistics and all that are really highly skewed, but it's a good starting point. But things to look out for, things you could even do in terms of concepts like active recovery, which are not widely implemented at all. But then also too, higher level applications for people that are stuck and dealing with severe disability and illness, not just physical, but mentally, metabolically, and otherwise. So I'm just going to go ahead and get right into it. So heal. This is healing from brain injury. What is it to heal? It's a word that's used a lot. Some people, as I'll talk about, I don't fancy myself a healer. I'm actually kind of uncomfortable with the word, simply because our patients, in my opinion, are the healers. We're a resource, we're a conduit, we're knowledge. We can help people get to things they couldn't get to, but it's ultimately them that is going to and has to do the work to get past what they're dealing with. So to become sound, whole, or healthy again is essentially the definition of heal. I kind of pull different parts of definitions from different places, but that pretty much covers it. What we're talking about here, in the concussion arena, which we'll be, focusing a little bit more on concussion, we see so many types of brain injuries, but we figure we pick the most common and the most treatable. And many people can get past concussion. Many people do get past concussion. But for the level of brain injuries that we see, most people are not fully healing. They're attaining higher and higher levels of humanism, but they're going to have in some cases, profound disability for the rest of their days. But we just want that forward trajectory for them, and we become a resource to hopefully help them get there. We're going to go ahead. So types of injuries we see, there's traumatic, there's environmental, there's all kinds of things, all different types of brain injuries. But traumatic, we have concussion, post-concussion syndrome, PCS, penetrating, non-penetrating head injuries, DAI, diffuse axonal injuries, which, the head it's essentially a really, 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 really bad concussion. The head is shaken about, and you have damage to the axon tracts and white matter. And some people can be, relatively okay, but most are severely, severely impacted by these types of conditions. Shaken baby syndrome, unfortunately, is something we see, either in the early years or people that have dealt with this throughout their lifetime. But nonetheless, they realize, and we realize, that improvement can be had at any stage of their path. That's the most important thing to understand, because the brain is continuing to learn and grow until we take our last breath, for better or for worse. People hear about plasticity, and it's a really, it's an amazing tool. It's an amazing understanding to have, but there's the dark side to neuroplasticity, maladaptive plasticity. And we're dealing with people that are really living with major compensations their brains and bodies have made over time. So they're stuck in these maladaptive states. And our job is to come in and hopefully help disrupt some of the maladaptive plasticity and create better outcomes through harnessing the power of plasticity. We see hematomas, cerebral palsy, acquired brain injuries. These are things non-traumatic. Some, as we'll see, encephalitis, there are traumatic causes. But hypoxic anoxic brain injuries, we've really become, over the past 10 years, specialist of sorts in hypoxic anoxic brain injuries, because most people are left to their own devices when they get through the critical stages, and the step-down care centers like Shepherd, Tier, Craig, if you're familiar with any of these places, brain injury rehab hospitals. But after that, there's no instruction book, there's no handbook. Kind of like having a baby, just hope for the best, right? And we want people to understand that there is hope throughout all stages of these injuries, particularly in the chronic stages. Hemorrhagic injuries, strokes, aneurysm ruptures, and the like. Cancer-related brain injuries, so tumors, space-occupying lesions causing actual damage to the brain, but also tumors can bleed, and they can cause hemorrhagic situations. Encephalitis, we see tons of encephalitis, particularly post-COVID. Encephalitis is a brain injury, and they can be chemically mediated or initiated. Infectious, autoimmune, thyroid conditions cause this, Hashimoto's. Poisoning, we've actually seen a number of poisoning cases where people have had profound brain injury from arsenic and all kinds of things, intentionally and otherwise. Alcohol and substance use. So genetic, these, the ApoE genetic variations can cause brain injuries at birth or subsequent to. Leukodystrophies, Tay-Sachs, if people are familiar with that. We're seeing a lot of littles with, pretty significant disability. And the challenge with those is they haven't gone through appropriate developmental stages in most cases. So it's not like somebody knew how to walk and talk and do all the things they did. We're trying to just do whatever we can to develop whatever neurological foundation we can with them in hopes that they can have a better quality of life. Okay, some stats. I'll just run through these quick. You can look them up. Again, they wildly differ from place to place, NIH, you name it. They all have stats. But roughly 2 million traumatic brain injuries annually, 2 million. 1.7 million other brain injuries, strokes and things like that, the majority being from stroke, close to 1 million. My gut tells me those numbers are a lot higher. Some of the numbers are outdated, but that's what we got. Motor vehicle accidents, 50% of TBIs. A lot of them can be prevented, some can't. But, people are going to drive the way they're going to drive. So I've got a daughter who just got her driver's license today, and she will not be driving until next February or March because she's doing really good at it. But I want to make sure she's able to handle whatever's coming her way for the most part, because the calls I receive on a daily basis. I had a consult today, a woman, 18-year-old child in a hospital in San Antonio, Texas right now because of a head-on collision that was technically her fault, texting and driving. So, we just want to be able to do whatever we can to empower folks. I mean, this is our public health portion of what we do as providers, teaching people to save their lives and save other people's lives. 300,000 sports-related injuries, brain injuries, grossly underestimated. I did some quick homework. There's about 100,000 schools in this country. So basically that's saying about 3 students at each school are going to get a brain injury or concussion. Why? And that's not even professional sports or anything like that. So wildly underestimated. And also too underreported, particularly in sports, because you have a culture of non-reporting, and we deal with UFC fighters, professional BMX people, Olympians, and if they're not on the court, the field, whatever it is, their sports medium is, and not performing, They're not going up the ranks. They're not making the money. We used to work with some NHL players, grossly underreported. Falls leading cause of TBIs in 65 and older, again, mostly preventable. 80,000 with long-term disability after brain injury every year, not just 80,000 total, but every year. 5.3 million living with disability, 100,000 die annually from brain injury, and 40.6 billion roughly for non-fatal TBIs. So enough with the kind of doom and gloom side, but I wanted to just give you an understanding of where these numbers are at. There's classifications of brain injury. Again, these are starting to change and they can vary widely from source to source, but roughly you have mild, moderate, and severe brain injury. And there's different factors, structural imaging, typically CT at first, MRI later, especially in the more severe injuries. Loss of consciousness, alteration of consciousness, Glasgow scales, and amnesia as well. So different stages, where you're at puts you into it. But at the end of the day, a brain injury is a brain injury. And the fact is, we could have somebody with a mild concussion that is far worse than somebody who had a severe brain injury. So, we accept the scales, we use them, we understand them, but we generally put that aside and just deal with that brain in front of us all the time, every time. Let's see. We're not moving here. Here we go. So classifications, another important thing, concussions and post-concussion syndrome are classified as mild traumatic brain injury. There's no such thing as a mild traumatic brain injury. 25 years at this, yes, you can have a hit to the head or a concussion and a couple of weeks later be doing better, but there are consequences from that. We understand CTE. I sit on the board of the Dementia Society of America, a board of advisors for them. And Kevin Jameson, the founder, tells the story. His wife, they were in a car accident, a fairly moderate type of car accident. And what happened was after the accident, she had a pretty large concussion from that. And over the years, just started declining and then passed. And they said the final diagnosis was CTE from one concussion. So we need to understand these things are not mild. Even if they're taken care of appropriately, there's possibilities that need to be dealt with. And another thing too, classifications, it kind of falls under here, but most people, or probably our estimates, about half the people that have concussion do not have loss of consciousness. That's one of the first things people say when we talk to them. Well, I didn't pass out. You don't have to. A mild 5-mile-an-hour fender bender whiplash injury is enough to cause brainstem traction injuries. And in those cases, they can be worse than an actual hit to the head because now you're dealing with autonomic dysregulation, blood pressure issues, heart rate issues, respiration, digestion. Brainstem injuries are bad, and we see them all the time, and most of them related to concussion. Disability often overlooked, the invisible injury. You don't have a piece of your skull that was taken out and put back together, so people don't realize it, and there's so many consequences from these types of injuries that are not mild at all. Okay, post-concussion syndrome, the standard is, 3 months later. We're looking at post-concussion syndrome typically 2 to 3 weeks after the fact, because if these things aren't resolving, more than likely these people are going to have some kind of, until they do something about it, some kind of permanent, symptoms or even disability. Estimates as low as 10 to 25% of those with concussion will enter PCS. Again, based on experience, that number is wildly, wildly low. Far greater incidence of females. So females get the short end of the, they pull the short straw when it comes to concussions because of a few factors. There's some interesting research in terms of neck strength. The stronger your neck is, the less likely you are to have a concussion, period. That's why these big NFL linebackers can take, 20, 30, 40 hits a game and maybe not have a concussion. But then you have a girl who heads a soccer ball on the soccer field. The next thing you know, she can't go to school because the concussion is so severe. So neck strength is one. Hormones is the other. There are studies that have shown if a woman is ovulating when she has a concussion, it pretty much doubles her recovery time and absolute chances of turning into post-concussion syndrome. Because when your body is, pushing those eggs along, hormones, hormonal resources are being diverted from what needs it the most. Let's see. Okay. Sorry, I got a little delay on the clicker here. I don't know, maybe a battery, Michael? Let me just do this. I'll go ahead. Okay, So what to look for? These are things you can look for in your family members, in your community, in your practices. The typical physical symptoms: headache, dizziness, nausea, ringing in the ears. These are things that are very, very common with concussion, but also visual disturbances. We look very heavily at the eyes, very, very heavily at the eyes. The eyes tell so much with regard to concussion. That could be visual sensitivities, blurry vision, tracking issues. I'll show you some stuff with that in a little bit. Fatigue, hyperacusis, sensitive hearing, but also ringing in the ears, parosmia and anosmia, smell issues, right? You can't smell, or you smell things weird. Smell is huge. Smell is the one cranial nerve that's a direct extension of the brain, the temporal lobe, that doesn't have any other pathways that they go through like other cranial nerves. So you should be telling, I'm not saying what anybody should be doing. From my standpoint, everybody should be testing smell in their office, because that tells you a lot about the brain. Because most people be like, I smell fine. But then you have them plug a nostril, you bring a known scent, some kind of peppermint oil or whatever, coffee, and then next thing you know, you're right under their nostril and they don't smell a darn thing. So you can't just take a patient's word for it. You have to test these things if you want the information. Sleep disturbances, obviously. Metabolic symptoms: dysmenorrhea, amenorrhea. I was talking about females. Almost every female we see with concussion has had some disruption in her menstrual cycle. They can often go for months without a cycle, but a lot of people aren't asking these questions. That can tell you for sure that this person has had a concussion, because there's a lot that happens metabolically after a concussion that we'll talk about. Fatigue, digestive issues, big one that often gets overlooked. Concussions affect the way we digest food. It affects our gut. The epithelial cells of the gut begin to degenerate within hours after a hit to the head, a simple concussion. So you now have leaky gut within 24 hours, 48 hours. And what does that translate into? It translates into problems with the endothelial cells of the blood vessels and the blood-brain barrier. So now you have a leaky blood-brain barrier because your gut has been destroyed because of a simple bump to the head. And then, a lot of these symptoms are being written off. Well, your constipation or diarrhea has nothing to do with your head injury. Absolutely does. Your lack of nutrient assimilation has nothing to do with your brain injury. It absolutely does. So we need to look at these things from a neurological perspective, a functional medical perspective, et cetera. Weight gain, weight loss. So I don't know if you're familiar with this concept of the term hypermetabolic dysautonomia. So when somebody has a hit to the head, typically with more severe concussions, if somebody's in a coma, generally they're having thousands and thousands and thousands of calories a day pumped into them, because their body is going through so much repair and recovery. Even though they're not moving, they have a constant need for calories. We've seen patients get as much as 10,000 calories a day, and they're laying in a bed, simply because there's so much going on, and neurons use a lot of fuel. So there can be significant weight loss in many cases if people aren't eating enough. But what happens after these things? People feel lousy, they don't want to eat. So there's options, medical foods, things like that, intravenous and otherwise. Thyroid symptoms as well, hair issues, skin issues. Okay, so what to look for? Cognitively, mentally, emotionally, most people, in this room would think brain fog, attention focus issues, impulse control issues, anxiety, anger, confusion. All these things are related to concussion. But again, a lot of people are written off, and it's, take this SSRI because you're feeling a little down. Take this benzo because you're feeling a little anxious. Take this sleep pill because your mind is wound up at night, so they give you a hypnotic like Ambien. And we are not anti-medication, but in cases like this, there's a lot that can be done to deal with these issues, because they absolutely have to do with the concussion. And also, too, if they had pre-existing issues, they will just be magnified. There's papers that talk about amplification of ADHD and things like that after hits to the head. It's absolutely true. Conventional concussion standards are still the wait and see approach. Cocoon therapy, just get in a dark room for 2 or 3 weeks and you'll be fine. That makes things so much worse in the long run, because when you sensory deprive somebody, the moment they get back, the moment they try to go to a supermarket or even drive their car, all heck breaks loose, because now they're being overwhelmed by all this stimulation. Anybody ever go in a salt tank, float tank? You get out of there and you just get bombarded with things, and they ease you out of it and all. But imagine being in a salt tank for like a week or so and then coming out. I mean, your brain would go nuts, absolutely nuts, because we need to be able to process sensory input. It can be overwhelming for people, and we need to take steps to lessen the impacts of that, but depriving altogether can be very, very difficult. Active recovery, this is another thing that you could begin to implement with friends, family members, et cetera. So we look at about 2 to 3 days of just pure rest in most cases. And then we want to get people on sub-threshold aerobic activity, so walking, stationary bikes, things that are safe because their balance might be off and things like that. You don't want them going out on a trail running. You don't want them on a regular bicycle for the most part. But just getting the heart going, because what happens when we move muscles, we produce antibodies. We produce neurochemicals like BDNF and vascular endothelial growth factor and all these other factors that are super important for recovery of the brain after a concussion. So we want to enhance that. Signs and symptoms and autonomic little type of their markers need to be evaluated. People can just go get pulse oxes. You can go to CVS and get a pulse ox for, $15, $20, and you can look at, erratic heart rates or flat heart rates with no variability. These are all markers that can tell you something as to what's happening in that system. Gradual layered exposure to environmental stimuli. Yeah, you might wear some glasses for a little bit, but, exposing the eyes a little bit here and there to actual life is really important, because the more you cut it out, the worse it's going to be when you get away from it. Supporting metabolically with low carb, the brain will crave typically carbohydrates because it's, the easiest source of fuel, and people want to comfort eat too and things like that. But it's really the worst thing to do after a concussion is to sit there and eat simple carbohydrates. Now, if you're talking about, vegetables and things like that, certainly better. But most people are going to go for the pastas, the pizzas, the rice, the things like that. And we want to make sure they're getting low carb intake, high quality fats, and then moderate protein. We don't want to do too much protein at this stage because they can actually, through gluconeogenesis, start to break down protein when they need immediate sources of fuel. MCT oil is another thing as well that can be immediately used as a source of fuel for the brain. Medium chain triglycerides, you can get them in any health food store. Do you have them there? Awesome. So she's got them right there. So go grab a bottle and get them. Awesome way for people to get fuel in without overdoing. And plus the fat will, create the feeling of fullness, so people aren't overeating with the chips and the pastas and all that.
How do you think about a sport?
So out of sports, that really depends. North Carolina's kind of funny in terms of return to play. We try to stay out of that equation because we're concerned with getting these people better, and most coaches and parents and student athletes don't like that so much. So we want to, keep, as long as they're having symptoms, essentially. It's their headaches and things like that, those can be overcome. But if they're dealing with balance and dizziness issues, visual tracking issues, they're just, they're going to get hit again. Because they can't see what's coming at them, especially if they're playing ball sports. And then just referral to a specialist if signs and symptoms persist and worsen, because, some of these post-concussion cases can be incredibly challenging. So here, I just have our standard post-concussion TBI and PCS supplement protocol. These are for fairly new injuries. We certainly do a lot of laboratory testing, and we don't just blanket and just throw a bunch of stuff at people for no reason. But these are things that can be used. I was talking about people not wanting to eat, just decreased appetite. There's medical food that we've been using for 15 years. We actually have docs at the Shepherd Center that have called us and said this stuff is brilliant because we can actually put it, people can put it in the peg tubes and the feeding tubes when they're normally getting, if anybody knows about hospital grade medical food, Nestle is the one that controls all the medical food in hospitals in this country. And it's, I think they finally pulled the high fructose corn syrup out of it about 2 or 3 years ago, but a lot of it still has it. So they're just pumping calories without any attention paid to nutrition. So this OptiCleanse GHI is gastrointestinal, hepatic, inflammatory. So these are medical foods that can really help create a lot of change in a lot of these systems without overdoing it. I mean, it's low caloric intake, but high nutrient dense intake. Optimag Neuro, these are from a company called Zymogen, the ones in bolds that we use. And then below that are different companies. But magnesium threonate, many people have heard of, the only one that's been shown to cross the blood-brain barrier. You have glycinate, malate, oxalate, all the different forms of magnesium. A lot of them work locally on the gut, but will not get past the blood-brain barrier. So magnesium threonate helps with the leaky gut, because when you have this leaky gut, you have these tight junctions in the epithelial cells and the lining of the stomach, the intestines. When that starts to break down, you have these proteins that basically aren't blocking these channels anymore, these tight junctions, they call them. And magnesium helps these proteins kind of get back in those channels to keep things from going out that shouldn't be going out and getting in that shouldn't be getting in. So absolutely critical, especially for initial stages. If people can get on that within hours of the head injury, outcomes are far, far better. Phosphatidylcholine has a lot to do with cellular integrity, inflammatory responses, et cetera. So there are, Monopure is one we use. It's our essential fatty acids, fish oils. We just like this because it's high concentrate in a pill form. We certainly have liquids if people need them, and those can be put into feeding tubes as well. We have people putting fats and medical foods into the feeding tubes, and it works wonderfully. Anxiety, Relax Max is another one. It's basically a GABA stimulant, so inhibitory neurotransmitter. It's just getting people to settle down a little bit. L-theanine is just a famous go-to for just kind of nervous system relaxation. Sleep, I put an asterisk next to that. We don't like to do a lot of sleep aids, simply because I've done a lot of research into the impacts of medications on EEG, because I do a lot of work in the EEG world. And the fact is there's no medications, save for trazodone, that don't have massive effects on EEG, rendering people unable to attain deep sleep. So the hypnotics, the benzos, all these things will impact sleep in a way that people will not. Even smoking a joint and drinking alcohol, all that will impact deep sleep. Melatonin impacts deep sleep in a bad way, not in a good way. It'll help you get to sleep, but it's not going to help you get good restorative sleep. So melatonin is good, but we have to be careful about things becoming habit forming for people. There's a few more there. You can just take a picture of the list. There's ATP, stimulants, bowel movers as needed. The more severe brain injuries, because people are on, on the pain meds and even baclofen, so they're dealing with decreased gut transit time, severe constipation. So we need to get things moving. It's a carbon-based supplement that really works better than Senecot or any of those, in my opinion. Works phenomenal. The bowel mover, it's from a company called Cellcore. Bowel mover, yep. And the rep is actually just down the mountain in Asheville. He's a great guy. Then we get into aggressive detox protocols as needed based on laboratory testing. So what is functional neurology? Holistic neuroscientific approach to evaluation and treatment of disorders of the nervous system with an emphasis on safe and effective treatment methods. Again, we're not opposed to conventional methods. We just find in the cases we see, there's not really great medication alternatives for what they're dealing with. Yes, for symptom management in the short term, but what happens is the short term becomes the long term in the vast majority of these cases. We've looked at probably 100 of our last concussion cases, and 6 medications is the norm for our post-concussion cases. Sleep, anxiety, pain, all the things. So that's a lot. That's a lot to rehabilitate from too when the layers are there like that. It's a nonlinear, a receptor-based, body-centric approach to brain health. The brain basically, works based on the information it receives from the environment. You step on a tack, your brain needs to get that signal so you can get your foot off that tack. There's a physical response, but there's also an emotional response. Somebody might say things they shouldn't say or scream or yell, but all of these things are connected. Everything's connected. But if we can drive sensory input to the nervous system in a very specific, detailed manner based on what we're seeing with diagnostic testing, we can really improve the output. It's just in and out, in and out, in and out. We improve the input, the output improves, cognitively and physically. So nonlinear understanding, that's important because even as we go through school, it's like, the cerebellum does this, the frontal lobe does that, this pathway does this pathway does that. It's all connected. You can't think of something and not have your whole brain be active. That whole, we only use 20%, it's a misnomer. Everything works all the time, some areas more than others. Okay. So the embodied brain, we work a lot on this approach. It's something I've really done a lot of study into, but sensory and motor systems are fundamentally integrated with cognitive, behavioral, and emotional processing. And you can also throw in there too metabolic function. So we need to look at the whole picture, as much as that holistic word has been overused over the years and, doesn't, kind of mean as much as it should. That's how we look at things holistically. We have to look at the physical, cognitive, metabolic, neurological, lifestyle, etc. So I'm just going to move forward because we got a lot to get through. The homunculus, everybody familiar with this guy or girl here? Basically, our brain sees us very differently than we are looking in the mirror. So there are certain parts of the body that have much heavier real estate in the brain than others. Our hands, our face, just as humans, we do a lot with these things that other animals can't do. So we can leverage these areas to help create a more embodied brain, if you will. So our approach is just one of, again, neurological, physical, cognitive, metabolic, lifestyle. We have to look at all of these factors all of the time, or we can really miss the boat. Neurological, basically understanding of the condition or absence thereof. There's a lot of people that are dealing with conditions that aren't necessarily conditions. And there's also diagnoses for conditions now that aren't necessarily conditions. Things like functional neurological disorder, conversion disorder, even getting into complex regional pain syndrome. These are brain issues. These are all brain issues. And if treated as such, generally can get better than just throwing on the layers of the medications that these people are often on. Just looking at their abilities, inabilities, connecting the dots, all the muscle reflex sensory testing, autonomic nervous system testing, testing of different lobes of the brain cognitively and physically with frontal, memory, and other things with temporal, fine motor control with the cerebellum. We need to look at all these different areas. Brainstem is huge for us, absolutely huge, because in most cases, the brainstem is injured. Physical, there's neurodevelopmental, muscle tone and strength can tell you a lot about how somebody's brain is working. I mean, think about somebody after a concussion with all they're going through. They're generally not, they're in their posturing. Everything is very different because their brain is not controlling everything the way it should. So these can be used as methods. That's why people respond well to massage and chiropractic care and acupuncture, physical, structural modalities, because you're basically bringing these areas of the brain up to a higher level when you do those types of therapies. Balance and gait, gross and complex motor skills, etc. The cognitive, attention, focus, impulse control, we talked about that. Metabolic, we have to look at prior and co-occurring health conditions. Somebody has a thyroid issue going into a concussion, it's going to get worse. Guaranteed, it's going to get worse. And there's metabolic mechanisms behind that. We got to look at dietary intake, consumption status and patterns, gut function, energy production, medications, toxicities as well. Lifestyle, all the things: diet, sleep, exercise, stress management. What is their home like? Home environment? Is it especially after what just happened down the mountain and up here? People are living in very toxic environments right now, and it's not good. They're creating brain injuries of their own sorts. So basically, brain function, fuel and activation. This is kind of the crash course on how the brain works in neuroplasticity. Fuel and activation. So fuel in the form of ultimately glucose, even though fats can be used as well for immediate fuel, like the ones we just talked about, the medium chain triglycerides. And fuel is also oxygen. That's why we do things like hyperbaric oxygen therapy for recovery of brain injury, because it's critical for that activation. So the activation component, a lot of things activate the brain, some more than others. If you look at these boxes, this is kind of a rough understanding of muscle and joint activity is by far the greatest input to the brain, by far. The largest nerve fibers in your peripheral nerves are 1A afferents that drive muscle information to your brain, not joints, but muscle. Vision, huge as well. Then we get into hearing, pain, temperature, pressure, and the other types of sensations. So neuroplasticity, two things: the frequency of stimulation, the intensity of stimulation. We do exclusively immersive rehabilitation programs, people with brain injury, whether it's a mild concussion or whether it's a severe diffuse axonal injury or aneurysm rupture, because the frequency of stimulation is everything. So we're working with people 4 to 6 hours a day, depending on other things they might be doing, because we have to do things over and over and over and over again for short periods of time in order for change to be made. Movement cognition. How am I looking on time, Michael?
Well, watched it.
That done work? All right. This is important, talking about how somebody is after concussion, or even as people are declining with Alzheimer's and things like that, they don't assume the greatest postures because the brain is not competent enough at that point to keep their motor systems and postural muscle systems working the way they should. I mean, look at babies and toddlers. They don't have good control over muscle tone. They don't understand, laterality, right versus left, up versus down. They don't have these concepts, but also too, they don't have great control over attention, focus, impulse control, memory, etc. The same thing happens on the other end of life. So in the middle, we need to be as competent as possible structurally. So our evaluations, again, this is just for when people are not responding. We go through full history. I was just talking to someone. Our average history is roughly 45 minutes to an hour, just talking with somebody. I just feel if we're not taking that time, we're missing the boat on so many factors. Then we get into the review of prior diagnostics, which most people have coming into us. Head-to-toe neurological evaluation, so your muscle reflex sensory evaluation, autonomic testing, et cetera. Computerized neurocognitive assessments, absolutely critical just to establish a baseline for that individual. EEG and other aspects of EEG, quantitative EEG, and something called S-Loretta imaging. We get into testing of eye movements, video oculography, dynamic posturography for quantification of balance systems, and then a few other things. Laboratory testing, I'll talk about. So the assessment end of it, we have the neurological evaluation, which is basically looking at all the fine motor control, muscle reflex sensory testing like I talked about. I want to get to this EEG, QEEG, and S-Loretta imaging, potent diagnostic tools and directors of clinical interventions, including things like low-level laser therapy, neurofeedback, but also too physical, cognitive, and other types of rehabilitation. This is your delta, theta, alpha, beta, gamma, all the different brain waves. And really important to understand how these things are generated. Brain waves are generated from the body. Thalamocortical pathways, meaning all the sensory input that comes from the body goes to the thalamus and to our big human-like brain. So that's what drives the production of alpha and theta and all the different brain waves largely is body activity, muscle activity. So that's raw EEG there, basically. This right here is something called S-Loretta imaging. So we're doing this source reconstruction, basically. And what we can do is we can see a little bit deeper than the cortex now, which is pretty darn cool. The software has just elevated so much in the past 5 to 6 years or so. What you see on the left here, this is an individual that had multiple concussions and COVID. And this is 3 hertz, so it's delta brainwave activity, very slow activity. And you see all this red just means they have way too much of that. And that's what happens with people with concussion. They have way too much slow activity. I tell people all the time, it's like driving your car with the foot on the brake. You're getting things done, but it's a real hassle. It's a real chore. And this was after some combined laser and hyperbaric therapies. And we're talking a relatively short period of time and seeing a really significant clearing to the point now we start seeing, where the injury actually was. Here you can't tell where the brain injury was. And here we're actually starting to be able to see what's, where the root of the problem is, essentially.
Hey, you're watching them get better.
Yeah, absolutely. Symptom-wise, absolutely seeing them get better as they go through that. This is another individual, similar case, multiple concussions, and same thing, delta and theta, really slow activity, way too much of it. And then also to beta or fast activity, we're seeing way too much, especially in these midline frontal and cingulate regions. So if you're driving the car with the foot on the brake, what do? You got to slam on the gas. So these brains are just bogged down with slow activity. They're working too fast, entirely inefficient, lends itself to all aspects of fatigue and the cognitive issues that they're dealing with that are often dismissed by their family members and their providers often, unfortunately. S-Loretta imaging. This is something I've been working with now for about 12 years. And you see, this is the frontal lobe of a brain, somebody that had a concussion. You see this blue rim back here that's basically saying they have a really, really low amount of beta brainwave activity. And what does that part of the brain do? It has a lot to do with moving the body. And this is somebody that could not move all that well. So they have all that blue activity showing there's no beta activity there, all this red in the front, and their thinking part of the brain that basically is trying so hard to do stuff that it's just, again, slamming on the gas while their foot is on the brake. Alpha peak frequency is an interesting number. We can measure one's ability to engage cognitively from an electrical biomarker. And this is something that's really cropping up in the literature. And that's something we see always down. Alpha brainwaves are 8 to 12 hertz or 8 to 12 cycles per second. We're seeing people around 7 or so with this alpha peak frequency, but over the course of care, they can get up to 8, 9. Average is about 10 to 11. But the faster it is, the more able we are to engage cognitively. And this is huge, especially for kids that are in school, and they really need their brains to work to get through this. Video oculography, you'll see right here, these eyes should be going back and forth like a windshield wiper. And look at this kind of stutter step or jerkiness, or just the inability for them to track a simple target moving back and forth on a screen. That is a concussion right there. That is somebody who should not be going back on the field, because that's somebody who's going to get blindsided by somebody coming to tackle them or a soccer ball coming at their head, because they're not going to get their eyes there in an appropriate way. Balance testing, cognitive testing, and then laboratory testing. Our routine labs, all the CBCs, chem panels, thyroid profiles with antibodies, also urinalysis, hemoglobin A1C, inflammatory markers. We like to cover all the bases there. Our routine labs are usually much deeper than what a GP is going to recommend for you, unless it's Dr. Mabry or others in this room. Because we know routine labs. They're looking at blood glucose. They're not looking at any of these other things. Blood glucose, your opinion, fairly useless marker by itself. By itself, yeah. So specialty profiles, we look at stool tests, urine analysis. We can look at micronutrients, the gut microbiome. We just want to really be able to cover the bases, neurotransmitters and hormones. I went for a bunch of years without doing neurotransmitters and hormones, but the technology has really stepped up. It's not going to give us all the information, but it's going to fill in some blanks for us, for sure. Intervention and treatment, I know we're running short. Yeah? Okay. So modalities, a clinic like ours with what we do, this is what we do all day, every day, concussion, severe traumatic brain injury. So we have to have a lot of tools. And at the end of the day, though, some of the simplest tools, the physical and neurological rehabilitation, the manual stuff, somebody looking at a dot on the wall and turning their head to stabilize their gaze and be able to get images to stick on the retina so that they're not falling off where people are at a higher fall risk. But at the end of the day, we look at a lot of different types of rehabilitation. Low-level laser therapy. I've got a couple of slides on this just because it is such a powerful. You can just Google low-level laser therapy and concussion. You will get a plethora of studies coming up. There's a book that was written in 2019, copyright. It's not a book. It's a compendium of the research of red light therapy, specifically low-level laser therapy on the brain with brain injury, Parkinson's, Alzheimer's, you name it. Really cool stuff, but low-level laser therapy is where it's at. A lot of red light therapy. I know a lot of people are using LED, nothing against it, but a lot of the studies done on low-level laser therapy, the sham group is LED. So LED is diffuse, laser is focused. There's a lot to the physics of laser, but the fact is we just go with where the majority of the research is. We use LED for other things, but certainly not for the brain injuries. Hyperbaric oxygen therapy, neurofeedback, biofeedback, audio-visual entrainment, if you've ever heard of that. Just helping to regulate brainwave frequencies with various types of flashing lights and sounds. Certainly not using that for our patients with seizures, which many severe TBIs have seizures. Post-electromagnetic frequency, electrotherapies, all kinds, transcranial alternating and direct current stimulation, lots of things out there. Musculoskeletal therapies, on and on and on. Whole body vibration. I'll talk about that all the time. I actually did a study that I presented in Paris a couple of years ago at the Sorbonne, which is an amazing experience. If you've ever been to the Sorbonne in Paris, I was in a room and there were pictures on the wall with, Descartes and all these people, and I was like blown away that I was actually in this room teaching with all these. Yeah, it was absolutely amazing. But whole body vibration was the subject, and it was how we can impact brainwave output with vibration plates. Frequencies, right? Frequencies. Brainwaves are frequencies. We can impact that with frequencies of light, frequencies of vibration, frequencies of pulsed electrical stimulation, things like that. So all modalities that we're using essentially are frequency-based therapies, even smell, sound, food. If people get into that real esoteric realm of looking at food as having, certain, healthier foods have higher frequencies. Processed foods have lower frequencies. So we don't want people that are trying to recover from a brain injury eating low-frequency foods. Okay, so that's just actually me getting my practice what I preach time in. Some audio-visual entrainment with laser. kind of do that as my warm-up routine in the morning. We stack and layer therapies. Most therapies physically and otherwise are typically bottom-up types of therapies. You know, you work a muscle, you do something, it impacts that, it ultimately impacts the brain. But we can do things, if we have somebody that can't use their right arm, we can actually do laser therapy or electrical stimulation on the opposite side of the brain in those parts that govern that arm. So now we have a top-down and bottom-up type of approach. And we just find, again, with the high repetition model, we get a lot faster, a lot sooner. Okay, I'm getting there. These are just some of the therapies, you know, where we do a lot of, you know, basic core stabilization, things like that. When somebody has had a concussion, we want to start strengthening that neck. I mean, that will start to have immediate improvements, get rid of their headaches. The headaches are the easy part when somebody's had a concussion. And they can, you know, they can get relief with, you know, Tylenol, they can get relief with an adjustment, chiropractic adjustment, but strengthening those muscles is really where it's at, and it's going to give them long-lasting relief.
Go ahead.
Oh, sorry. And then there's this little guy on the vibration plate in the middle. This was a stroke at birth. And we can do things, again, layering and stacking therapy, so doing complex motor skills while they're on a vibration plate. The one on the right side is a fellow looking at what we call optokinetic stimulation, so we can use iPads and other things that we can program the speed of movement so people are tracking at certain levels, because certain people can track at certain speeds, but not others. So we need to focus on the speeds that they can. I'll get into a little bit, and please let me know, Michael, when you want to take questions. Low-level laser therapy, photobiomodulation. If you take the word, break it down, turn it around, it's basically the ability to influence cellular, body, and brain health using concentrated sources of light. Wavelength, power, and frequency are the three variables with laser. Low-level laser therapy is very low power, non-heat producing, very safe for use transcranially. You do not want to be using a class 3 or class 4 laser heat producing at a high power on the brain. And I've heard about this, that people are getting that type of therapy. So be real careful that the person, you know, using laser therapy knows what they're doing. These are some of the lasers we use in the office. We have a ton of them. I have a laser problem. I need to go to Lasers Anonymous and get some help. But it's because they're so powerful. We've invested a significant small fortune in lasers over the years, but because they work, they do what they're going to do, and they do it very well. At the end of the day, number one right there is probably the most important thing: enhanced mitochondrial function, or ATP production, electron transport chain, Krebs cycle, all this good stuff, right? What do lasers do? They cause electrons to move around and be distributed differently. Energy, putting energy into cells. But the fact is, you get certain sources of light on cells and you will produce more energy. Different forms of light activate certain parts of this electron transport chain differently, but decrease inflammation, improving hemodynamics and angiogenesis, formation of new blood vessels, neurogenesis. Now they're showing certain lasers at certain wavelengths can actually create production of nerve cells in the brain, and a bunch of other stuff. So right here, this is this electron transport chain right here. I don't know if you can see it. So we're using now, we've actually for the past 2 years have introduced green and violet light. Violet, you know, you hear about violet, ultraviolet, extremely great for pathogens, you know, for bugs. So the violet light is being studied very heavily now because it is the most energetic. It's the fastest of, you know, red, violet, red, violet, green, red. Roy G. Biff, got to go to that thing. But yeah, violet is about 400 nanometer wavelength, and then red is, you know, in the 600s, and green's right in the middle. But they all activate different parts of this electron transport chain. So stacking and layering the different types of laser therapy is just allowing us to get places a lot quicker than we used to be able to. So a couple of things, journal trials, photobiomodulation using low-level laser therapy for brain injury. So outcomes, basically, safe and effective technique in significantly improving memory, attention, and mood performance in healthy and neurologic patients. Also low-cost therapy. This is the Journal of Neurotrauma. Low-level laser therapy applied transcranially to mice significantly reduces long-term residuals. So can actually stop people from going into PCS. This was clearly a rodent study, but we see this every day in practice. If we can get lasers on the brain within 2 to 3 days, hopefully within 24 hours of that injury, most people won't need the long-term rehabilitation. And this study too, they went on to say it was about a 50% reduction in recovery time, getting that light on the brain. And that's the Journal of Neurotrauma. Here, IMedPub, Neurology and Neuroscience. Basically, this was for severe brain injuries, looking at coma response scales. People that were in comas or states of akinetic mutism where they're there, but they're not able to move or talk or anything like that. Low-level laser therapy significantly improved these scores from very low to really quite high to scores that would indicate they're going to have very positive outcomes just by getting light on that brain. And this one here, you spoke about Alzheimer's a little bit. This is huge. Low-level laser therapy rescues dendrite atrophy. This stuff gets me excited here. Upregulating brain-derived neurotrophic factor. What it does basically, they're showing it's reducing the burden of the beta amyloid plaques in the brain in people that have Alzheimer's, but also too, the dendrites, the part of the nerve of a nerve cell that pull in information from axons from other nerves. It basically spares the degeneration of those dendrites, which are not spared in brain injury, in Alzheimer's and things like that. So hyperbaric, neurofeedback, biofeedback, manual therapies, something called the interactive metronome, a phenomenal tool for attention, focus, impulse control, self-regulation, which is a huge deal post-concussion. Neurosensory motor integrators, big touchscreen TVs where we can look at hand-eye coordination, memory drills, but also incorporating balanced cognitive and physical tasks all at the same time. Whole body vibration, everybody should get a whole body vibration plate in their home or their office. I mean, the studies too, not just the brainwave stuff we're doing, but the impact on the gut microbiome. They were showing, I think it was Hopkins that did it. I think it was 20 minutes a day for 4 weeks, whole body vibration at 30 hertz, increased healthy gut bacteria by a factor of 17. That's massive, just standing on a vibration plate every day. It's a therapeutic stress, basically. We combine hyperbaric and laser for really acute injuries, and generally we can thwart the long-term rehabilitation programs. And this I want to put up. I can open up to questions after this. I had some cool videos and all, but I know we're short on time. This right here was at a BBC. It was a multi-site study that's kind of in the works now. It's nothing that's been published yet, but you have these really bright minds in Germany and Berkeley and all these other places that are treating things like concussion and COVID, and they're basically saying they're one and the same. They're one and the same. And it was May 20, I actually wrote this in my journal, May of 2020, March of 2020 was a bad time. May of 2020, 2 months later, I started talking about this kind of the after effects of COVID. It wasn't even long haulers, wasn't a thing for a year and a half later. And I basically said, and just kind of stuck with this, that it was a viral brain injury, a chemical brain injury, because all of these COVID patients, we got thrust into this post-COVID category because they all walk and talk and act like post-concussion cases. Even the diagnostic testing, I could have 2 people, 1 COVID, 1 concussion, look at all the diagnostics. If I didn't know anything about that person, I would say they were both concussion cases because they're brain stem injuries. They go very heavily into this. I highly recommend looking this up because the parallels they make and the way they're looking at this is on a level that I haven't seen in most research in the past 5 to 10 years, especially in the neuro world. So pretty powerful stuff. Okay, y'all go ahead and open it up. Let me do this. This is a guy, we had to do this. The guy went back to the hotel after coming in. He had a really unfortunate situation, was working with a stove, and the stove, basically one of those old steel stoves, and the stove blew and basically right into his head, and just, the massive penetrating head injury. And he hadn't taken any steps prior to coming to us. And his mother sent this, they got to the hotel that night, and his mother sent this video of him
right there.
So he was never able to put one foot in front of the other, especially that left leg. He wasn't able to bring that around. And all we had started doing with this guy was transcranial laser therapy and hyperbaric oxygen. We couldn't do much from a rehab standpoint other than passive activities. And his mother sent us this video at 11 o'clock that night. He was just walking up and down the halls in the hotel. It was pretty cool.
Yeah, Brent.
And this is a guy who's confined to a wheelchair for the past 2.5 years. So it's not to say, look at these miracle stories, but miracles happen every day. in everybody's practices, just be able to embrace and amplify those miracles. That's really where it's at. And if it wasn't for families like that, those miracles wouldn't happen, unfortunately. So,
Same thing.
oh yeah. So we'll go ahead and this is a little guy. I just got to talk about him. He was from the Ukraine. They were out on a boat, and another boat, drunk driver, kind of came, hit their boat, and went over, and he got clipped by the prop on the boat. Basically, flew right over his head and just took that part of his head off. And it's the right side of his head because you can see he can't move the left side of his body. But this is the coolest thing. This is the first pull-up he did. He was wanting so bad. It was like 2 weeks after he came. He was wanting to do that pull-up, and he did his first little pull-up there. So awesome. I love that. So cool. I just love our patients. They're absolutely amazing. A couple of papers I can share with you that I had written, and a chapter in a book on concussion and addiction, which is a huge topic for me. Top 10 health list, kind of brain health tips. You can look at the full descriptions. I put the link up there. It's just at our apexbraincenters.com. And you can just search for top 10 tips. But, I wrote this over 10 years ago and it still sticks. Sometimes things will change, but, sleep is probably the most important thing with regard to brain health. Easier said than done, but, we can talk about things that will help that. Managing stress, exercising, plenty of fluids, eating the right kind of fat, learning something new. I put veggies first because fruits, the jury's out. We don't do a lot of fruits with people because fruits are sugar. And, people will eat a lot of fruit to get that fix, even if they're starting to eat healthy. So, you need to be somewhat diligent on your, dietary recommendations with fruits. Social is huge. Socialization, decreased socialization reduces myelin production in the nervous system. That's huge. Absolutely huge. So everything from neurological issues to just full-blown dementia. And it's getting to be more and more of a problem. Eliminating bad habits goes without saying. Setting goals and moving towards them, dopamine rushes, little goals lead to the big ones, but will certainly help that dopamine producing system. This right here, I have to say, I was in, the square in New Orleans, if anybody goes down there, Franklin Square. Anyway, that was my daughter's, probably 7 years ago when she was in her all black phase, wearing all black. And she ran into this and she was just mesmerized. Stood there for 30 seconds looking at this machine from the distant past. They still have it there. But yeah, there's some contact info. Feel free just to reach out. And, social media pages, we have a really active social media presence. And if you want to see stories and understand more, we do a lot of educational stuff on there too, and just, free to the public. I've got a podcast with 330 episodes I did. It's just completely free, but all kinds of really cool topics on, brain health. So feel free to listen to it. Yeah.
What is going to open up for questions as well for every minute? While we had with the
questions. Yes.
and then or
It's so what kind of oil? She was asking what kind of oil. Was I talking about before for brain health to be used as fuel? Medium chain triglycerides, MCT oil. And you have your source right there. Yes. Yes.
so when I had my cup was instead to her. And then I had the surgery for pure the anesthesia on the surgery to be activated. So
Yeah. So she had surgery and the anesthesia appears to have rebooted some of the prior concussion symptoms. Absolutely. Anesthesia, chemotherapy. We see a lot of chemo fog. They're chemical brain injuries and they're just magnifying. And especially because of their impacts on the brainstem, just like COVID. Yeah. Yeah, absolutely. Yeah. Yeah. Are we using PEMF? We do. It's so we used pulsed electromagnetic stimulation, which is a form of PEF. And we're doing almost exclusively transcranially, and we're doing it with in concert with neurofeedback primarily. So as somebody's on neurofeedback, we can impact certain brainwave frequencies by using certain frequencies of the electromagnetic stim. Yeah. Yep.
Anything like first about ultrasound therapy. I know the illustrators on it mainly works to be almost every we're doing.
Yeah. So ultrasound frequencies, that's the thing. So we have a laser in the office that has pending FDA clearance for dementia because its impact on breaking up the tau and beta amyloid plaques, not just with dementia, but Parkinson's, CTE, et cetera. The only thing that was shown prior to that was sound waves. But clearly introducing sound waves into the brain is really tricky territory because just think of shockwave blasts and things like that. Sound can cause physical trauma where light can't. Are we using ultrasound? At this point, no, we used to. But again, just looking at the literature over time, we just want to pay respect to that. And the fact is we're getting the outcomes with the light therapy. There are a lot of people getting into the soft wave and the shock therapies transcranially. And in my opinion, it looks promising, but the jury's not close enough to being there for me to be comfortable with that. Yeah.
Thank you, friend. Yeah, thank you. I feel like we could do like a 12-day course on that pretty easily. Kelly, you want to come up? And Crumley House and Nessa? Cool. Yeah, come on. So what I thought we would do for about 10 or 15 minutes is actually hear from some friends who have had head traumas. Nisa just mentioned a second ago that, take this one, that she's had several head traumas in the past. And then we have Ms. Kelly with us from the Crumley House. Sometimes I think it's best just to hear it straight from people who have gone through it, rather than us just reading about it. And so maybe while Kelly's coming up, why don't you tell us just a little bit about your concussion and what you experienced after that? Maybe symptoms, maybe how people treated you.
Well, the major concussion that I had was I was in a hardware store reaching for a spray can of paint, and one of them flew down and hit me in the notch of my eye, my right eye. And I immediately didn't quite pass out, but it took me about 20 minutes to find I was completely disoriented. The big box store I was in just tried to get me out, and et cetera. I finally did leave the store. I drove without realizing that my vision had been completely distorted. I was looking right at a red light, major red light with two things, cars everywhere, and I saw it, but it didn't have any, it didn't register anything. And then so I did get to the hospital, and then I had other visual problems where I'd look right at someone, and I said, do you know where my friend so-and-so is? And it would be my friend. I couldn't see. I couldn't register. I could see, but nothing had, there was no connection. So I had, the neurologist that I saw at the time said it was borderline contusion, which I guess is a more extreme version, I don't know. But I had a lot of pain when I moved. So for quite a long time, just moving through space was excruciatingly painful. I lost speech. My son would say, Mom, you're making no sense. I didn't know I wasn't making any sense. So it was a long period of rehabilitation, and at that time, the neurologist said the main thing you can do is rest. Fortunately, my diet is pretty much what this wonderful doctor suggested. So I was doing that part well. But since that time, then I had a couple of other more minor head injuries. And as I mentioned, when I had massive anesthesia, massive surgery, from that time forward, it was like re-upping a lot, not necessarily the same, but another range of symptoms from the concussion.
And it lasted for years?
Oh, absolutely. My first major one was 20 years ago, and I still, under certain types of impact, I still deal with the effects of it.
Introduce yourself. in the Crumley House.
Okay. Hi, guys. My name is Clay Morlock. I'm the program director at the Crumley House over there in Limestone, Tennessee. We're a traumatic brain injury center. We have long-term care, residential care, and we have a day program that we have people come out. One of the things we focus on is socialization and just the basic things that make people feel good in life. We have exercise programs. We have technology programs to help people learn to use technology to help with their deficits. And some very basic cognitive functioning exercises that we do with people. But the big thing is getting people together, letting them have a chance to talk with each other and, yes, some peer support, and get them back out in the community. A big thing we try to do is take people back to the community, get them out, whether it be shopping, whether it go out to eat, things like that. A big thing is that socialization, as Dr. Trayford was saying. There's that. And this is Miss Kelly. She's one of our residents there, and I'll let her kind of introduce herself.
I'm Kelly Wilson, Florida Sunshine, and he's a pretty good guy. I think I'll keep him with
I'll pay you later.
the program that they have at the tour have is so good. They keep you active. They give you physical therapy, and they give you speech and different things that you need, and they help you with your bad balance, which I have bad balance. So I broke my hips and stuff, and they help to give physical, therapy and stuff, and they have cognitive, and they help you get realization back in the world again and not being an outcast.
How long have you lived with your brain injury?
Long time.
Okay, long time.
Since 81.
It's 81.
81 again.
So what do you think helps you the most, Kelly?
Just doing things on my own, and feeling good about myself and stuff like life's way looking over me like that. Just do it on my own and knowing that I have the strength to do it and stuff to accomplish something.
You think it helps you to have friends around?
Oh, yeah. Oh, that helps out a whole lot.
Yeah.
Lots of friends, especially he's a pretty good guy, too. One of my closest friends, they help me out. And we're there if you need them. So I'm not used to using the microphone. But it's a great place to be. And I can really rehabilitate you back to walking again and working again and just different things like that. And it's a socialization too. You have a lot of friends there, and it's not, they'll have guns, so they do this and that. They just let you do it on your own.
Yeah, we'll keep the guns away, yeah.
I warned you about that.
I know. Good.
So, Nisa, what do you think helped you the most in your healing journey?
I keep learning.
I keep learning. The vibration plate, I have that, but interestingly, post the surgery, the capacity to get myself to move. It's like, where did it go? I mean, it's the weirdest thing. So it's an ongoing, I focus a lot on nutrition and all of the elements that this gentleman talked about. Socialization is really important. Any kind of stressors can reactivate any of it.
Any stress.
Yeah, any kind of stress. So it's lifestyle modification, self-care, hope, and persistence, and a positive vision for my future, being interested in where I'm going and what I do, continuing. It's been an education in patience, as well as perseverance, and gentleness to myself, because I was a pretty type A person, and wanted to get it done, so I get it done, right? And when I'm under that kind of stress, when that's reactivated, I have to be patient. So it's been a very positive growth experience because I've chosen that route. And the effects are still there.
So I think what I hear you saying and what I heard Dr. Trayford say was, it's not just like fish oil. It's supplements, food, sleep, stress, friends, and community. We talk a lot about loneliness. That's what Kelly said was her favorite thing, having friends around, and they support you. They're not forcing you to do anything to support you. And all these things, I feel like a broken record. I talk about those things all day long. because they're the simple things that actually work. But it's also the hard thing because you have to do it, right? Ozempic's easy, but it doesn't actually heal you, right? And so, what questions, we're actually right on time. What questions might you guys have for our panel?
Is there a spirit journey, a relationship with God that goes along with your recovery?
Let me go.
Here you go, Kelly.
Yeah. Jump in.
Give me a hold for it.
No,
Okay.
I can do it myself.
You got it.
Just stay back. No, I'm getting weak in a lot of areas, but I know that I have Christ's strength to help me
And then
fight the stress and stuff that I go through. You know, he's the best friend you can have, but I'm supported by him. Yeah.
Them.
Yeah, I would agree. The deepening of spirit, I've always had that connection. It's always been central to my life, and it's a deepening on a practical level. You know, bringing that spiritual life into my daily experience and activities in a more pragmatic way that's necessary, and I value that. So that's where I say, you know, there's the growth process, which is great, but that's a choice. Maybe. It's a grace. It's also grace.
Maybe one more question for our panel. These are lovely people to have to ask questions. Oh, go ahead, Dr. Chapman.
Did you have a learning disability that you didn't have before after you? Are you asking me? Not really. I mean, that's for whatever grace. On my worst days, I still have a lot of mental acuity, good cognitive grasp, commitment to learning, and that has kept me going when the physical limitations have been extreme. So for me, I'm very grateful for that.
I guess my last question would be for you guys at the Crumley House, for you guys, Michael. How can we support you guys as a community?
Well, we always do our fundraisers. So we are a nonprofit, and we do our best to try to help the community any way we can. So we have our Jogging for the Noggin. You're always welcome to come out and run a 5K with us. That's in March.
Do that together.
Yeah, it's always fun to come out there, and you can run your 5K and then come and eat all the pancakes you want. So it's a great time. And we have other, you can always visit thecrumleyhouse.com. We can see other fundraisers we have. Also, we encourage anybody, if you know students, to come down and work with our guys. We work with a lot of the local colleges to try to expose people to brain injury. So many times you get to see what's in a book, and you get kind of scared. You think, maybe I'm not going to be able to talk to Miss Kelly. Maybe I need to talk to this Clay guy over here. But as you see, Miss Kelly can handle a lot of things on her own. And sometimes that piece of paper that says brain injury, can be a little confusing to a doctor or to somebody. So they get to learn that. They come in there, they get to work with our members, and they can see that, they're still adults. They're still people, they're working hard, working hard every day. So, so send people our way. Come support us down there at Crumley House Limestone. Thank you.
Yeah. Thanks, Clay. Yeah, thanks to our panel. Yeah.
Thank you.
You're welcome. And so, I'm very impressed we're on time. Let's see. So we just have a couple fun things to go over, and then we have a raffle, which I always like, because we have some fun giveaways. Thanks, Logan. But that's just fascinating. The brain is so fascinating. And I feel like all the stuff you just showed us, I feel like it's probably still just scratching the surface. Like, why do frequencies affect some people and not others? And it's just fascinating. My heart is the way God's made me is when I see people suffering, I'm always like, how do we alleviate that, right? And how do we pull a group together and go after it? And so y'all remember back in January, we had, I shared that Tennessee has some of the worst health in the country. Do you guys remember what we rank out of 50?
wait, 7.
That
48. 48 out of 50. And I just read last week we're number 1 in cancer death. And that shocked me. I'm like, man.
We had the worst duct tape.
Was it? That's interesting.
Yeah, we got the absolute worst in the whole.
And you couple that with obesity, diabetes, heart disease, all those things. And so when I see that, I'm like, those are my people. Tennessee's my people. I love Asheville as well. but grew up and born, raised here. And so there's a fun opportunity coming up. Are you guys familiar with the Blue Zones? Have y'all ever read that book? So myself and some other medical organizations are looking to partner with the Blue Zone group out of California. And they actually go into areas and give a very detailed assessment. Like they live in the area for 8 months. They bring all these stakeholders together and we try to figure out how could we improve the health of East Tennessee. And that's a really exciting idea. It costs a little bit of money, so we're pulling together hospital systems and medical groups and businesses and all this. But something fun we have coming that I'll give y'all more info later is we're gonna have a first Healthy Tennessee conference in January at the Heart Song. And I'm trying really hard to get Dolly there, so I will let you know. But we're trying to get some big speakers. Joel Salatin said he was gonna come. If you're familiar with Joel in the farming world, we messaged RFK today. I've messaged all kinds of people. And so we're trying to bring in unique people for a 1.5-day conference down at Dollywood. And so that'll be launching here soon. But obviously I'd love to include you guys in that because this is right up our alley. And what we'll be doing is we'll be inviting farming groups, school systems. I have some superintendents coming, medical groups, hospitals, businesses, industry, trying to figure out how do we, because it's not, health isn't coming from the medical system. I hate to say it, but we're at the table. Health's really going to come from community. And so the whole goal of a Healthy Tennessee conference is how do we as a community, as a state, how do we not be number 48, right? How do we like help the health of our people and be known for, hey, look at Tennessee, how they turned their health around, right? Which goes right along with some political things right now, Make America Healthy. Those are conversations never had on the national level. So that's why I'm having, praying RFK will come hang out at that. But I have a 5-minute assignment for you guys at the tables. You'll notice you have your little white piece of paper there. So as we are working with Blue Zones, as we're having this Make Tennessee Healthy Again conference, what would you guys say, and just talk at your tables and write it down for me, are the most important strategic things to go after? That's my question for you. Practical, strategic, how can we really start, make a meaningful impact in our area? And then I'll come back in like 5 or 10 minutes and we'll talk about them. So go.
Well, everybody, that's a wrap. We had a great conversation tonight about mental health. We also had some really great table conversations about ways we can help improve the health of our region. As you may or may not know, Tennessee and East Tennessee is actually ranked 48th out of 50 in the nation for health. When they look at obesity and diabetes and heart disease and drug use and alcohol, and they take all those things and put them together, we're ranked 48th out of 50. So we're always trying to find ways to bless our region and help improve its health. And so we talked about that at roundtables tonight and came up with some really wonderful ideas that we hope to implement in 2025. And so our next upcoming talk will be January 27th, and that's going to be on hormone replacement. And you will not want to miss that talk because so many people suffer from hormone imbalance, from young men and women all the way up to 60s, 70s, and 80s. So thank you guys for tuning in, and it's been a pleasure